Hi, this is Jen Rubin, editor-in-chief for The Contrarian. Delighted to have with us one of our friends from CAP, Andrea Ducas, who is the Vice President of Health Policy. Welcome.
Thank you. Nice to be here.
Nice to have you here. So let's get down to brass tacks about this big bad betrayal of a bill. What does it in its current form, based upon what we know, do to Medicaid?
Yeah, so it would enact the biggest cut to Medicaid, which is health insurance for very low income people in this country, in the program's history. It would cut a significant amount of money from the program, and it would do so by kicking people off of the program. So the Congressional Budget Office, which is the nonpartisan analyst arm for Congress that advises them on the impact of their legislation, has estimated that the bill, combined with the expected coverage losses from the ACA marketplace tax credits becoming less generous at the end of the year, will result in about 16 million people losing their coverage, which is pretty staggering. I mean, it's a mind-blowing number. And with respect to Medicaid, that would be 7.8 million people, just because of what's in this bill, would lose coverage. Primarily, the biggest source of that coverage loss would come from the work requirements in the bill. That number's actually probably going to be higher, which we can talk about in a bit. But the bottom line is that the bill would result in a substantial coverage loss among people enrolled in the Medicaid program. Upwards of 8 million people would lose their coverage.
To be clear, Medicaid, first of all, does not cover illegal immigrants.
It does not.
So put that aside. Secondly, it has work requirements. What they are doing is putting more red tape, more paperwork. And from studies we have done, the vast majority of people in these new paperwork requirements that fall out actually are qualified, but they just can't deal with the paperwork, or they get behind, or something is missing. So what would this accomplish other than shoving people off the rolls? This is not people who are cheating the system in any sense.
It really wouldn't accomplish much other than that. And just to clarify, I mean, right now, to qualify for Medicaid, there's not, unlike food assistance and other forms of government assistance, there is not a requirement that people be working or engaged or doing community volunteering in order to get health insurance, because it's health insurance. It's not a material benefit. It's not like money you get from the government. It's something that when you use it, if you need it because you're sick, a provider is reimbursed, right? And they're not, they're not holding the bag for an unpaid bill. So there intentionally haven't been work requirements on Medicaid, even during, the Clinton era welfare reform. Intentionally, Medicaid did not include work requirements. Before the Affordable Care Act, in order to get onto Medicaid, in many states, you either had to be a child, a pregnant woman, a very, very low-income caregiver of a small child or young child, or have some qualifying disability. After the Affordable Care Act, for the first time, the federal government gave states the option to expand their Medicaid programs to include adults without children who are extremely low income, right? People living at the poverty line. These are mostly people, as you correctly stated, who are working. They're just working in the types of jobs that don't offer health insurance. I'm sure many of your listeners have been in those jobs. I worked at Dunkin' Donuts that didn't offer benefits. Uber drivers, right, often fall into this category too. So Medicaid becomes a lifeline, right, for people who are either in jobs that don't offer coverage, that don't make very much money, or who have, health needs that keep them from working. So the work requirements, all they would do is they don't force people to work. They just force people to prove that they have a job, right? And we know 98 or so upwards of 90% of people on the Medicaid program who fall into that category are either working, they're caring for kids, they're in school. They don't need an incentive to do what they're already doing. And we can see from states that have tried to do this, right, that all that happens is people who are eligible for the program and would have met a work requirement just lose their coverage. And I just want to say, again, that this bill, the whole purpose of this bill, right, is to extend tax cuts from the first Trump administration. And the purpose of the Medicaid cuts isn't to make the Medicaid program better, it's to find money, savings to pay for those tax cuts. You can only save money with a Medicaid work requirement if people lose their coverage. If overnight, like if you know, gave the benefit of the doubt to these lawmakers who definitely do not deserve it, and everybody, flip a switch. Work requirements means everybody's engaged in the community. They're all working. The government wouldn't save any money, so the math wouldn't work. So that,
Yes.
I mean, it's really plain as day what the purpose of the work requirements are. It's just to pick people off their insurance.
Right. And it's important to remember, people think that Medicaid is only for the poor. There are these other categories of people, children,
Yes.
seniors in nursing homes, and the
Yeah.
rest who are affected by this. I just saw a poll that was really kind of startling. I think it said 80%, close to 80% of Americans now support Medicaid.
Yes.
It is a remarkably popular measure because people get that we don't want a bunch of sick people of whatever income. Um, People like Senator Tillis have gotten wigged out about this because lo and behold, there are hundreds of thousands of Medicaid recipients in his state. Just before we came on, you were relating a comment that Senator McConnell made coming out of the Tuesday luncheon that the Senate Republicans have regarding these gargantuan cuts. Tell us what that was.
Yeah, well, we saw some reporting that indicated that Senator McConnell made a comment along the lines of, "Yeah, we're going to get heat from this, and people aren't going to like the Medicaid cuts, but quote, they'll get over it," which is kind
This
of shocking.
They'll get over it. People are going to die anyway. Those are the explanations people are giving for taking away Medicaid. And I have to remind people, there have been estimates done by Yale and by Penn that we're talking about 50,000 additional deaths each year because people will lose coverage, both Medicaid and through the exchanges. Talk to us a little bit about what would change in the ACA, that is the exchanges, where people have been able to purchase affordable health care for themselves.
Yeah, so there's a lot of changes in this bill with respect to the Affordable Care Act marketplaces. And one thing to note before going into those is that, as I mentioned earlier, at the end of this year, after 2025, the enhanced generosity of the tax credits that people get to purchase coverage on their own through the ACA marketplaces are set to expire. Very intentionally, these were not extended as part of this bill. In fact, Republicans in Congress, when they were voting on amendments to add to the bill, voted down an amendment that would have included an extension for these. So we already expect to see a number of people to find coverage unaffordable absent those additional subsidies. To give you an example, if you were somebody making, like if you're somebody who's making 401% of the federal poverty line, which is not very much money, you would get no help at all, right, to purchase a plan on the exchange. The enhancements made sure that everybody, no matter what their income was not going to be expected to pay more than 8.5% of their annual income toward premiums. So you would get help that would bring you down to the 8.5% number. That would go away. In the bill, there are other changes that to open enrollment periods to just make it harder for people to enroll. You or you probably have insurance through your employer. I do. Many millions of Americans have coverage through their employer. Every year we go through open enrollment, but typically if you're not making any changes, you just continue on. That's how it works with the Affordable Care Act marketplaces. But the bill would do things like auto charge someone a copay or a premium that wasn't paying a premium before, make you go in and do more verification to prove you are who you are and you live where you live. It would exclude some people, including lawful immigrants, categories of lawful immigrants, from getting help at all, including DACA recipients who purchase insurance through the marketplace. There's another provision in this bill, which I think is underappreciated, which is pretty gross, which is that if you fail to meet a work requirement for Medicaid and you lose your Medicaid coverage, you would be prohibited from getting a tax credit to buy insurance through the marketplace. You'd be cut off entirely. So you would have no affordable option. This is wild to me, considering that in order to qualify for a tax credit to buy marketplace coverage, you have to have income. So you have to be working. So we have done the math about what these changes, there are other changes in this bill too for the marketplaces, will mean for people's pockets. And just to give you a sense of this, a couple that's 60 years old, so a couple together making $85,000 a year, their premium cost would go up by about $15,000 a year. For a 40-year-old making $40,000, if they're on a gold plan, which, you know, has lower deductibles, and you know, their premium spikes, so they want to save money and they go onto a silver plan, downgrading is going to cost them $1,500 a year, and they're going to have a deductible that is almost $4,000 higher. A 30-year-old, excuse me, a 30-year-old couple making $64,000 a year on the cheapest plan, the bronze plan, high deductible plan, in order to stay on that plan would have to pay $3,500 a year. It's more than what they're already paying. So that's what we expect to see. Higher costs for people with marketplace coverage, higher costs for many people with Medicaid, because there's also cost sharing for Medicaid enrollees in here, and higher costs for many people on Medicare. So there's, you know, something terrible for everyone in this bill.
Yes. And the Medicare part of it comes into play because try as they might to slash all of these things that working people get, they still don't have enough to pay for these ginormous tax cuts. The latest figure was something like 4.2 trillion is that cost. And when that happens and the deficit opens very wide, there is something called like an automatic rescission, meaning that automatically parts of the federal budget will be cut. There is no way to make that math work unless you cut Medicare. And so this sacred, beloved program that Trump swore he would never, ever, ever touch would also be cut. And we don't know how that would be done and whether it would be higher premiums, whether it would be reduced benefits, what have you. This is a monstrous bill that, Andrea, it seems the only purpose is to take health care away from people in order to give tax cuts to billionaires. Is that right?
I mean, that's what it seems like. And every analysis of the bill, looking at, I mean, again, like tax experts, finance experts, health experts, everything we're seeing is that there's one group of people that's going to benefit and one group of people that's really going to hurt. And on top of that, right, the savings from that hurt are going to be flowing to the people who are benefiting. I mean, that's exactly right. And just to put a finer point on the Medicare issue, not only could that trigger like an automatic sequestration, so like a hair trimming, but there's another provision in the bill that would hurt 1.3 million Medicare enrollees, very low income Medicare enrollees. This is because so we were talking about how you qualify for Medicaid. Many people on Medicare who are very low income become dual eligible for the Medicaid program. There's different ways of becoming dual eligible, but one way is just to like have a limited income and asset level that lets you access something called a savings program. And what that program does is pays for your deductibles and premiums for your Medicare plan and helps make prescription drugs cheaper. And to give you an example, and this is like, again, these are CBO numbers, 1.3 million Medicare beneficiaries. If they are not able to access these programs anymore because of the changes in this bill, you could see a person on Medicare who makes $19,000 a year, which is not very much money, have their expenses go up by over $3,000 a year. A couple making only $21,000 a year, so that's $10,000 a person in this couple, could see their costs go up over $8,000 a year. These are Medicare enrollees. It's underappreciated. It's something that I find quite shocking. And I was surprised, remained in what we're seeing might be in the Senate text, but it's very much intentionally in there.
Friends, if you didn't think this bill was horrific before, this should be hair raising to you. And I would ask all of our contrarians to do what you've done in the past, pick up the phone, send an email to your representative, Republican, Democrat, say it is absolutely unacceptable to take people off healthcare in order to give billionaires more money. And if that message doesn't get through, that's exactly what Republicans are going to do. And their attitude, you heard it from Senator McConnell, is you'll get over it. Tell that to someone who depends on Medicaid. Tell that to someone who depends upon the subsidies for healthcare. No, they're not going to get over it. And frankly, they're going to turn around the first opportunity and vote those people out because they're not going to get over it. Thank you so much, Andrea. You are a wealth of information, and let's hope the works get gummed up and this doesn't go forward in its current fashion. We'll look forward to having you again. Thanks so
Thank you
much.
so much.